up here in Prince Edward Island, Nova Scotia as kids, and we traveled across the country and had our professional careers in Calgary, and now we're retired, and we really like it here in Nova Scotia, and we're back.
Yeah, we're here to commemorate a bit of an effort that Carolyn and I have been on over the last, in earnest, over the last 5 years, associated with expressing ourselves in a more philanthropic way. We took a bit of a structured approach to our giving as a family. Not surprisingly, you go back upon the skill sets that got you to where you are now, and to us that involved a bit of financial planning. And the phrase "in our lifetime" was critical to us, and it is one that puts basically a timeline on it. And in the world where I come from, it leads to project-oriented decision-making, goal-oriented activities, putting it to work. We were looking for an opportunity to invest them with players, active players in the philanthropic community in Lunenburg County, directed at goals that were more or less preset by a statement of need. And the statement of need in this case was the headlines you read, what you got on the CBC, what you got on the South Shore Breaker. And we thought, is it possible to tackle the headlines? Is it possible to make an effort supporting the philanthropic players that would be responsible for taking a run at that headline? We asked a few questions. Health Services Foundation was the door we were told to go knocking on.
When you move into any community, you look around and you want to see how the community is functioning, how it's, you want a good community, you want a secure community, and you want a robust community. And we read the newspapers and talking to people in the community, and we found that there was a bit of a gap here with local GPs filling in, and people were anxious about it. And so we felt that was a need that we could help facilitate. So our gift, our donation was $500,000 over 5 years to the Health Services Foundation here for physician recruitment here in the county of Lunenburg. Well, that comment, giving in our lifetime, it touched something in both of us, I think, because waiting till you pass away and then this will gets executed and then perhaps this money gets dispersed, that, I don't know, it didn't do anything for me.
Giving locally is a goal. Giving during our lifetime is a goal. Giving in a fashion that, in a business parlance, you can leverage the opportunity, get involved, is a goal.
I think that the kids have seen this in us as they've grown up in our family, and now that we've retired and we're more involved in this, they see it happening. They don't have the time yet to join us as much as we would like in the decision making around this, because they're young and pursuing their careers themselves. But we're hoping that as time goes on, they get more involved with us in the decision making about how to execute the funds of the foundation. Find something that you're very passionate about. That will give you a lot of energy for investing time in research in that area and feeling very comfortable about your contribution, whether it be volunteer hours or financial. And then you'll be happy. You'll find that thing.